someone asked, please get Gil back on about the prostate information. This old crap needs to be put to rest. He probably talks about TRT being bad for the prostate.
So Dr. Morgenthaler, who is a professor at Harvard Medical, he's also a prominent urologist out of Boston, as well as our very own Jordan Grant, who's a urologist in Paris, Texas, who's reiterated a lot of Morgenthaler's work. Morgenthaler has published a ton of Harvard papers on how this old nonsense about prostate health and testosterone being detrimental to it needs to stop. I believe he sits on the board of the American Urological Association, AUA. And I actually saw on PubMed, you can find this, he actually wrote an entire list of about 30 or 35 items that he wants the AUA to reconsider. It's like a mission statement he wants them to put out a mission statement debunking a lot of the nonsense. And he actually wrote this, I think it was published in 2019. You can find it on Google Scholar or on PubMed. Look up Abraham Morgenthaler, and you will find a lot of work that he's done on prostate. I know Jordan's got guys on active surveillance for prostate cancer that he treats with TRT. So this whole androgen deprivation therapy, or ADT as they call it, that has been old, standards of care in urology to castrate guys, chemically castrate guys, and crush their testosterone because they feel testosterone feeds prostate cancer, has been debunked. And this is evident by the fact that we don't see many guys in their peak testosterone years coming down with prostate cancer. We don't see guys during puberty, right? Testosterone, presumably on a natural level, is peaking at puberty. I know DHT peaks at puberty. This is the hormone that gives you the deeper voice, the male characteristics that defines, going from a boy to a man. This is all DHT related. DHT spikes during puberty. How come we're not seeing all these 16, 18-year-old boys coming down with prostate cancer during the peak of their DHT and testosterone cycles, right? Because we see this later in life, again, due to almost anything in our body. It's cellular degradation. It's the inability of your DNA to reproduce properly, and in some cases overproduce cellular proliferation, which is what cancer is. This is not caused by testosterone. It just isn't.
Check out my TRT workout split or the ebook The Ultimate Guide to TRT Cream. Links to the merchandise shop in the description.